Here's an explanation of how each of these popular remedies might be associated with an increased risk of dementia. 1. Benzodiazepines. Benzos like Valium, Ativan, and Xanax are widely prescribed for stuff like anxiety, trouble sleeping, muscle issues, and seizures. But there is a link between taking them long-term and getting dementia down the road, and how come? First, they make people drowsy and foggy, messing with memory focus, decision-making, those cognitive skills. With ongoing use, that can turn into serious mental decline. Also, years of exposure might actually damage brain cells involved in thinking and remembering. And for older folks who already metabolize meds differently, the effects seem even worse. So their dementia risk goes up more than other age groups. Finally, physical dependence and nasty withdrawal from benzos also hit cognition. So if someone can't easily stop taking them after chronic use, that withdrawal might tip them over the edge into dementia by harming their brain function further. Basically, we need to be really careful about long-term benzo use, especially in older patients, because evidence suggests it could substantially raise their risk of dementia. More research is still needed, but what we know so far is concerning. 2. Anticholinergics. Anticholinergic medications work by blocking acetylcholine, a chemical messenger in the brain involved in memory and learning. These drugs are used for treating various conditions like allergies or incontinence. However, some research has raised concerns about potential links between long-term anticholinergic use and an increased risk of dementia, especially in older people. The thinking is that blocking acetylcholine can lead to cognitive problems over time. Older folks already experience some decline in memory and brain function, and blocking acetylcholine may speed up that decline, making the brain more vulnerable to dementia. The risk seems to increase the longer someone takes these meds. There's evidence showing a correlation between higher cumulative use of anticholinergics and greater odds of developing dementia later on. The effects seem more pronounced in elderly patients since their brains change with aging and have a harder time processing these drugs. More research is still needed, but current evidence suggests doctors should carefully consider risks versus benefits when prescribing anticholinergics long-term, particularly for older patients. Maybe lower doses or shorter treatment courses could help minimize risks while still managing conditions. Close monitoring for any cognitive changes is also reasonable given the potential dementia concerns with these medications. 3. Tricyclic antidepressants. Tricyclic antidepressants, or TCAs, are medications often used to treat depression and anxiety. Some common examples are amitriptyline, nortriptyline, and imipramine. These drugs have links to dementia down the road. One reason is that TCAs have strong anticholinergic effects, meaning they block acetylcholine receptors in the brain. Acetylcholine is key for memory and learning, so blocking it long-term can lead to memory issues and raise dementia risk. And in addition, TCAs can make people drowsy and foggy. Over time, this sedation can contribute to cognitive decline. The drugs dampen mental sharpness and slow thinking, while TCAs help with mood by altering serotonin and norepinephrine. Tweaking multiple brain chemicals can disrupt normal thinking over the long run. This can chip away at cognition. Older adults face higher risk. As we age, our brains change and have a harder time processing medications. Seniors taking TCAs tend to experience more cognitive side effects, making decline and dementia more likely. So in summary, TCAs may spur dementia in some, especially older patients. The anticholinergic properties, sedative effects, and neurotransmitter changes seem the main drivers. 4. Antipsychotics. Antipsychotic medications are used to treat mental health conditions like schizophrenia, bipolar disorder, and severe depression. Some common ones are risperidone, olanzapine, and quetiapine. These drugs work by shifting the balance of brain chemicals called neurotransmitters, especially dopamine and serotonin. Messing with these chemicals can affect thinking skills like memory, focus, and decision making. Over time, this might contribute to mental decline, and long-term antipsychotic use has been tied to thinking problems. Patients might struggle with memory, problem solving, or other mental tasks. How bad it is depends on the specific drug and how long you take it. These meds can be risky for older people, particularly those with dementia. Giving antipsychotics to elderly dementia patients is linked to faster mental decline and even death. After years of use, antipsychotics might be toxic to the brain and cause physical changes along with more mental impairment. So antipsychotics used to treat severe psychiatric conditions are linked to cognitive decline and an increased risk of dementia due to their effects on neurotransmitter systems and potential neurotoxic effects. The risk is particularly high in older adults and those with pre-existing cognitive impairments. Careful monitoring and consideration of alternative treatments are essential to mitigate cognitive risks. 5. H2 receptor blockers. H2 blockers like Zantac and Pepcid reduce stomach acid to treat issues like gastroesophageal reflux disease, GERD, and ulcers. There may be a link between taking them long-term and dementia, though. While they're not as strong as some meds, H2 blockers might still have mild anticholinergic properties. Those effects can mess with acetylcholine, a key neurotransmitter for memory and learning. Over time, that could impact cognitive function. Also, long-term use stops your body absorbing important nutrients properly, like vitamin B12, and not getting enough B12 is tied to cognitive decline and greater dementia risk. Suppressing stomach acid for ages interferes with taking in nutrients you need. There aren't many solid studies showing H2 blockers directly cause dementia, but some research hints long-term use might have subtle effects on cognition. So, H2 receptor blockers, used to manage acid-related gastrointestinal conditions, have been associated with potential cognitive risks, primarily due to their mild anticholinergic effects and impact on nutrient absorption. While direct evidence linking these drugs to dementia is limited, careful consideration and monitoring are advised, particularly with long-term use. 6. Antiepileptics. Anti-seizure meds like Dilantin, Depakote, and Lamictal help control seizures and epilepsy. But some of these drugs might raise people's risk for dementia down the road. Here's how. First, they can muddle up brain functions like memory and decision-making, especially at higher doses or if you take them a long time. That could make it easier to develop dementia later on, and also, years of using certain anti-seizure meds may actually damage brain cells and circuits that are key for thinking and remembering clearly. For instance, Dilantin's been tied to memory issues and visible brain changes when folks use it long-term. Plus, these meds tend to interact with other prescriptions, which can make cognitive problems even worse. Those interactions likely add to the risk of mental decline. And if you're an older adult taking a combo of drugs, not just for seizures, that seems to be an especially bad combo for brain power. The total load of medications can really drag down mental abilities and contribute to developing dementia. 7. Statins. Statins are drugs that help lower cholesterol and hopefully cut people's risk of heart problems down the road. Some common ones are Lipitor, Zocor, and Crestor, and there's mixed research on whether they might affect the risk of dementia too. On one hand, lowering cholesterol with statins seems like it should help the brain since cholesterol gunks up brain cells if you get too much. The meds might also reduce inflammation and oxidative stress, which both mess with cognition. But cholesterol is important for making myelin and cell membranes in the first place, so maybe statins could backfire and cause issues from having too little cholesterol for the nervous system to work right. Some studies have also spotted potential cognitive side effects, especially in older folks, but the relationship is complicated, and other research found protective effects against dementia instead. More work is needed to clarify if statins help harm or have little impact on brain health over the long run. 8. Proton pump inhibitors. Proton pump inhibitors, or PPIs, are meds that reduce stomach acid. They're used for things like gastroesophageal reflux disease and ulcers. Prilosec, Nexium, and Prevacid are some examples, and there could potentially be a link between long-term PPI use and dementia, though. A few ways that might happen. PPIs can interfere with vitamin B12 absorption over time. Vitamin B12 is key for cognitive health, and not having enough is tied to mental decline and higher dementia chances. PPIs might also change gut bacteria, leading to imbalances. Gut health affects inflammation and brain health overall, so gut issues could contribute to cognitive problems. Constantly suppressing stomach acid with PPIs might also hamper nutrient absorption. Things like magnesium and calcium that are important for proper brain function. Deficiencies here can negatively impact thinking and contribute to dementia. Some research indicates PPIs themselves might directly impact the brain by affecting neuroinflammation or overall bodily health. So in summary, long-term PPI use could potentially raise dementia risk in a few ways, though more research is still needed. But it's thought to be linked to vitamin B12 issues, gut health, nutrient absorption, or direct neurological effects. 9. Opioids. Opioids are medications that doctors give for bad pain. Things like oxycodone, OxyContin, morphine, and hydrocodone, Vicodin. They help with pain, but might mess with your brain. These drugs make it so you can't think straight or remember stuff as well. If you take them for a long time, it can really slow down your brain and make it hard to make choices. The chemicals might even kill off some brain cells for good, and that's bad news, and could raise your chances of getting dementia later on. If you get dependent on opioids, it also causes issues. When you try to stop, you go through withdrawal and get confused and irritated. That scrambles your brain even more. Plus, pain drugs often go hand in hand with anxiety, depression, and other mental health stuff. All of that combines to hit your brain function and memory. It's complicated how opioids' pain, mood, and brain power all impact each other. 10. Hormonal contraceptives. Hormonal birth control. The pill, the patch, the ring, IUDs. They all use hormones to stop pregnancy. But could they mess with your head too? The theory goes like this. Playing with estrogen and progesterone levels changes how your brain works. Estrogen especially seems tied to memory and thinking straight. So if your birth control makes estrogen go up and down all over the place, it might make you more forgetful or cloudy, and some studies do connect the pill to mood and brain fog. But it's subtle, not well understood, and different for everyone. Age and how long you've used hormonal birth control seem to matter too. A 20-year-old on the pill for a year won't have the same experience as a 45-year-old who's used it for decades. But does hormonal birth control actually lead to dementia down the road? The jury's still out. Right now, there's no slam dunk link between the two. More research is needed. So in short, hormones impact the brain. Birth control impacts hormones. So there could be a connection. But it's complicated, unclear, and needs more study. We can't say for sure yet if the pill puts you at higher risk for long-term memory issues.